Welcome back to the Bite Size Podcast, where we talk all things faith, fitness, and functional medicine. And today I'm so excited to have a local expert with us, Miss Joanie Jackson. She's making a headway in South Carolina and quickly becoming known for alternative cancer treatment. What I love most about Joanie is she is so compassionate about healing and transformation at Freedom Integrative Wellness. And so this isn't just a business for her. She's literally on mission and so full of compassion and kindness. She literally treats patients like family. And so I can't wait for you to hear from Joanie and learn all about what she's doing and maybe come visit us at the practice. So welcome, Joanie. I'm so happy you're here.
Thanks. Yeah, I'm excited to be here. Thanks for having me.
Absolutely. So let's just dive right in. What led you to functional medicine and ultimately here at Freedom Integrative Wellness?
Yeah. So, to be completely transparent, I was looking for something different during the pandemic. I was working in a long term care nursing home setting at the time and was just starting to put some pieces together, obviously given the pandemic and the vaccine. And I was just like, something's not right about this. Didn't know the first thing about anything holistic or functional, was completely naive. But there was a job posting here. And so I told them, and I was very just straightforward in the interview. I'm willing to learn. They know I'm starting to put pieces together and there's got to be an alternative path. And they were willing to take me on and just completely taught me. And the more I started to learn, oh my gosh, I was all in. Like both feet jumped right in. There was no turning back. It was a matter of, and it still is a matter of just relearning medicine, everything we learned as a nurse practitioner, at relearning everything, but with a functional lens and looking at it differently and really trying to get to the root of the issue.
Yes, that what a perfect tee up that was. So, can you talk a little bit about like behind functional medicine? So, what functional medicine looks like from a root cause perspective versus managing symptoms.
Yes. So I can say a lot of these things because I was trained in the conventional system. The difference between the two, a lot of times when patients go to their doctor or their nurse practitioner, primary care, they are having symptoms and they're looking for a solution. And the providers, are doing what they know best based off how they were trained. And that's usually using a medication. But that's not really getting to the root of why we're having the symptom in the first place. I often will explain to clients, and it's almost like your check engine light. Your symptoms, whether that be high blood pressure or anxiety or insomnia, that is your body's check engine light. And it's saying that something is out of balance, something's not right. We need to look into this a little bit further. And that is functional medicine. We're doing the deeper dive. We're looking at things not just surface level, not just 15 minutes, here's a medication or a pill for an ill,
Yeah.
which we know is just a band-aid. It's covering up that check engine light. It's not getting to the root of the issue. So what we do in functional medicine is we often do different tests or more comprehensive testing. Unfortunately, it's stuff that insurance generally will not cover. But by digging deeper and really pulling back the layers, we're often able to get to the reason behind and then get people off of these medications, or at least find the solution to the issue in the first place.
Yeah, yeah. So how do you integrate the holistic side and the conventional side for whole body healing with your patient?
Yeah. Well, there's certainly a time and a place for medicine. A few weeks ago, I had a client come in here and her blood pressure was extremely high to where, my number one concern was, I don't want you to leave here and end up having a stroke or some other, issue because your blood pressure was dangerously high. So I had the conversation with her at this point in time, like we might need to use a medication just to get you out of that danger zone, bring you back, bring it down, get it under control while working on lifestyle and dietary interventions and things that we know that are going to change the body change your microbiome, change your level of inflammation. When we talk in functional medicine, we talk a lot about inflammation in the gut. And we know these two things are kind of the root of all disease. So if we can get that under control, then ultimately the goal is that you don't have to stay on that blood pressure medicine. And in fact, we have a big plastic container at the front of our office where, it's a good release for patients, and it's a good visual for other patients coming in to, like, when they're no longer needing these medications, we have them toss it in there. And it's therapeutic for them. And it's, like I said, a great visual,
Yeah.
but it's just showing that, again, it's a pill for an ill. It's just covering up that it's a Band-Aid.
Yeah. Yeah.
So having that conversation with the clients, and then there's a time and a place for medicine, and making that decision with the client to make them feel a part of, obviously, is a part of their health and their outcomes.
Yeah. So I know alternative cancer treatment that's becoming more widely known, and your clinic is, like I said, the head of that, and it's becoming a more accepted part of medicine, and patients are very much interested in it. So, what can you talk about a little bit more about what your clinic's doing and what that looks like?
Yeah. So when we started offering IV therapies, um, you know, started initially with just kind of like the basics that everyone else was doing. Every type of hydration clinic was offering a wellness or a Myers cocktail or some type of immune support. The more research I started doing on cancer in general, because the Lord just put that on my heart. I don't have a personal cancer story. I haven't been affected, luckily, by someone close to me with that type of diagnosis. But it was just became a passion of mine. And I do think part of it goes back to the surge in cancer that we're seeing since the COVID vaccination. And it's just not fair. It almost makes me like just frustrated that now patients are having to deal with this. And so I started just really diving into what are some alternatives. I started seeing things. I started with high dose vitamin C, and that was the first one that I started offering.
Your
Started
gateway.
into that. Yeah. And so high dose vitamin C is great. And that's probably our most popular drip right now in the clinic because it's so good for the body. It protects your cells, and it's harmful to cancer cells. And we've seen where it improves energy and appetite and just so many things with our clients, with or without chemo. If they're doing other therapies, it's helpful across the line.
Mm.
So I started with that, and then one thing led to another, and it's like, oh, well, we can do this service, and oh, well, we can add in this therapy as well. So we offer several different IVs now to help support clients dealing with that diagnosis, and it all goes back to supporting the mitochondria, giving the body the nutrients that it needs, energy, and things that are basically creating an inhospitable environment for those cancer cells to continue to grow and metastasize. So ultimately, it's helping to lead to apoptosis, or that cancer cell death.
Yeah. That's awesome. You mentioned patients that are doing both. They come to you for the alternative cancer treatment, but there might be going and getting chemo and radiation as well. That's something that they can do.
Yes, absolutely.
That's awesome.
Unfortunately, there's not a lot of education that's public, I guess, about that. And so there is always often that having that conversation with clients about what they're doing specifically, because they certainly don't want to cause any sort of fear or uncertainty that anything would conflict with other therapies that they're doing. But there is supporting evidence that all of the things that we're offering here are, in fact, safe and can be used in synchrony with chemo and radiation.
Oh, that's awesome. That's comforting. And I'm sure that brings a level of hope for, the patients that are just really wanting to rid their body of this. Um, can you talk about any success stories or give us an insight behind the curtain of maybe someone who came in with no hope at their wits' end and then saw real results from the treatment that you provided?
Yeah. Well, I will say I started these therapies um, mid to late last year. So I don't have an actual, like, no evidence of disease yet, but I know there's one coming. It's just trying to be patient. But we have had success stories where patients came in and had were given a diagnosis. We're told that they would live 4 to 6 months.
Oh,
And it's been 9 months to a year.
wow.
And they're still out living their life. They have the quality of life.
Yeah.
They're enjoying this added time with their family when they came to us with no hope and they were just, yes, like, let's just do something. Let's see what happens.
Yeah.
And then in particular, some of these are clients who were, doing things alongside chemo and radiation. I'm not one of those providers that's like, oh, it's because of what I'm doing. Like, I don't care where the credit goes, as long as my clients are thriving.
Yeah.
I want them to have that quality of life back and that time with their family that was going to get taken from them. So that's what I want, is to see them thriving through cancer and beyond.
Yeah.
So we have had several instances where, they're given that extra time back. And then not only that, I have one client right now who he's near and dear to my heart. He's an older gentleman and he is so spunky. And it's so fun to see him come in for his infusions. And his wife will tell us, and she's like, yep, he went and mowed the grass last week. And it was like, he wasn't doing this type of stuff before.
Yeah.
His quality of life, his energy, he's wanting to go out and visit with friends, and he's wanting to go to church and things that before he wasn't doing.
Yeah.
So again, it's that added time. It's that quality of life. One day we're going to get that no evidence of disease. I just haven't been doing it long enough, or, even have reached the amount of clients to maybe get that result yet.
I love that. That's so encouraging. What would you say to someone who is battling cancer or a chronic illness who feels like they've tried everything?
Yeah. Mindset is the biggest thing. Like, I feel like that is so, so important. And in fact, we give a devotional guide to all of our clients that are coming in for our IV therapies, because you have to believe it. I mean, number one, when you wake up in the morning, what your outlook of the day is going to determine how your day goes. And if you're doom and gloom, there have been, studies and reports that have shown that, to where patients who have a positive outlook of, like, we're going to nip this in the bud and we're going to, keep fighting, and they live so much longer.
Yeah.
So it's easy to get burdened down by that. I can totally understand that you're at your wit's end, and obviously this is taking time. The therapies are taking time away from work and time away, and they can get costly. So I understand the frustration, but trying not to lose hope, having that positive mentality. Because going back to those studies, they have shown where if you are doom and gloom, or it doesn't make a difference what I do because ultimately the outcome, is going to be this, then one of the cancer conferences I went to, they talked about a case study like that. And I mean, and she passed in a year, whereas someone who lived like 20 years.
Wow.
With an active diagnosis the entire time.
Yeah. Wow.
So it definitely goes back to whether you're a spiritual person, or if you believe in a higher power, or if you're just, having that positive mindset, believing in something bigger, and not giving up.
Yeah.
And keep doing things. Like, there's so much more literature coming out. There's constantly new evidence and new supporting therapies that we're learning about all the time. So don't just settle on what you've been told. Get a second opinion. Keep looking and keep fighting, because there's always new information that's being released.
Yeah. I love that you said that, because I recently have been talking about that, about your mindset, and your body won't go where your mind won't allow it. And of course, what I was talking about was from a fitness perspective, but it's the same concept. And if you can't wrap your mind around it, if you can't see it in your mind's eye, and you don't talk to yourself, but you allow yourself to listen to your thoughts, it's going to go down a negative rabbit hole, because we naturally do that, and we just have to get control over it, not to be conformed to the world, but the renewing of your mind, and just having that constant dialogue with yourself. I think that makes all the world of a difference.
Absolutely.
Yeah. Kind of switching gears here. on the education side of it, what is something that you wish people knew or understood about functional medicine?
Probably the biggest thing is that functional medicine takes time.
Mm,
It is not a quick fix. And it's frustrating because we live in this society where it's like a microwave,
yeah,
what's it called? Microwave mentality. You want
yeah,
it done
yeah, yeah.
or in 30 seconds. You want it done the sooner the better. And you go to your doctor for a sinus infection and they give you an antibiotic and a steroid, and yeah, you're better in 48 hours. But you can treat that naturally, but it might take a week in that case. So it's all in going back to mentality, having the appropriate expectation
Mm,
of, do we want the antibiotic that's going to destroy our gut microbiome and then lead to other issues? Also, not to mention that antibiotics are overprescribed in so many cases. If it's truly a viral illness and wouldn't have responded to the antibiotic anyways, you would have been better in 7 to 10 days regardless.
yeah.
So if you had just waited and done your due diligence, you probably would have gotten over it anyways. So, and obviously that's just one example of a sinus infection is something simple, but people go to their doctor all the time for that. And they're out 15 minutes later with an antibiotic. Obviously, there's much more complex things that we treat with or in functional medicine: gut issues, SIBO, autoimmune conditions, Lyme, mold. These things. I mean, we're talking about months. And in the example of Lyme, a Lyme life cycle is like 18 months.
Wow.
So it's a journey. It's not going to happen overnight. We expect our like journey to healing to be like a ladder where we're just moving up. And it sometimes is one step forward, two steps backwards, or, two steps forward, one step backward. You're going to go both ways as you're healing. But with functional medicine, when we are addressing the person as a whole, looking at their lifestyle, looking at their sleep, looking at their stress, looking at their hormones, it's not just one issue, one single issue. It's a whole bunch of things that have compounded. And also, if you think about how long you've been sick, it's going to take you that long, if not twice as long, to get better.
Yeah.
So if you've been dealing with something for 2 months, well, it could take up to 4 months to get better. If you've been dealing with something for 2 years, you can't expect to feel better in a month or two.
Yeah.
So it's certainly just trying to set that realistic expectation. That time is important with functional medicine.
Yeah, absolutely. I love how you mentioned looking at them as a whole, because thinking, with conventional medicine, when you go to the doctor for, this symptom, that's all they're treating, and not to discredit them at all. They're just doing what they're taught, but that's all they focus on is that symptom. Whereas what you do is you look at everything because it's all connected. And you're absolutely right about with the whole healing process. It's just like a diet. You didn't become overweight overnight. It was years of this habit, and that led you to this. And now it's not going to just reverse in a week of you eating good and working out. It's going to take you just have to relearn everything all over again and address the whole issue. I love that. What is a myth about functional medicine that drives you crazy that you wish everyone knew the truth?
That functional medicine doctors, which I'm not a doctor, I'm a nurse practitioner, but still functional medicine providers are quacks. That all we do is use supplements, which, I mean, I will say there's good and bad to every field, and there's good and bad providers in every field. So I'm not going to say that there aren't some functional medicine people that solely rely on supplements or are just trying to push as many supplements down your throat. But supplements are a bridge. And if you're deficient in nutrients, like, we need to rely on supplements for a period of time. It's in a different sense than like a medication. Um, so yeah, I feel like a lot of times it's meant that, oh, and functional medicine is so expensive. Well, that's because we're not spending 15 minutes with you. Like, we're having to do testing that insurance doesn't cover. We're spending a lengthy amount of time to really get to know you, know your whole history, all of the things so that we can take better care of you. It is expensive. It's an investment in your health though, because where are you going to get with conventional medicine? Most of the times you're not going to get the answers that you're looking for or the solutions or the help. So those are probably the things that drive me crazy the most, especially probably the supplements and the pills. It's like it's so much more than that.
Yeah, yeah, for sure. I know. um, so as we're wrapping up, how can patients or our listeners contact you? What's the best way to get into the clinic or hear more about it?
Yeah. I mean, we're located in Fort Mill. You can certainly check us out on our website, the freedomintegrativewellness.com, and all of the therapies that we're able to offer. And, we have the direct primary care. So we see all ages, newborn through adults, to care for your whole family for those primary care needs where you have options and where you have medical freedom. Hence the name. So definitely in giving that integrative approach. So the direct primary care, our IV therapy, our cancer therapies, all of that's listed on our website. Can certainly check us out on our social media, and then also just give us a call at our office. We'll get you connected and go from there.
Awesome. I'll make sure to put everything in the show notes. Real quick though, I'm going to do a rapid fire question. Try not to think about it. Are you ready?
Yes.
Okay. What is your favorite scripture for healing?
Jeremiah 29:11.
I love it. I love
And
it.
that covers so many things, but yeah, we don't know our plans and we don't know his plan for us. And we want to try to rationalize everything. And I'm the type of person that I like to plan and I want to know why.
100%.
We're not always going to have that.
It's structured. A to B. I want that plan. And if A to B is not working, I want plan 2.
But we have to trust that he has everything under control and he knows why.
Yes. All right. Second one. One health practice that you never skip.
Goodness. Oh, goodness. Try not to think about it. I guess I'm not consistent about it. So I don't know. I guess I do skip it. Definitely trying to get, goodness, this is hard. Because I'm sitting here thinking like water, grounding, but I'm not consistent on things every day because the life just happens.
Right.
Trying to get outside probably at some point, more than just from the car to the office and vice versa. Like going outside, getting sunshine, whether that be a walk or just going outside and grounding for a few minutes, but trying to spend some outside time in nature.
Outside.
In some form or fashion.
Yes, I love it. Okay, last one. Bone broth or coffee?
Bone broth. Are we talking about for health benefits or like favorite drink?
You, in general. Bone broth or coffee?
I mean, I would prefer coffee. But I was sitting here thinking, like, wait a minute, bone broth is so good for you. So.
It is. All right, Joanie, thank you so much for being with us today. I've absolutely enjoyed talking with you and learning more about what you do at Freedom Integrative Wellness. And I can't wait to see what the future holds for you. And you are doing amazing things out there. And I just pray that your light continues to shine and the growth of the clinic is abundant. Thank you.
Thank you.
Bye.